Varicose veins. This is a very, very common veiny problem that is present in up to 1 out of 4 people. So today we're going to talk about what it is, how you get it, how to reduce some of the symptoms, and ultimately how to treat it. Welcome to Talking with Docs. I'm Dr. Brad Wheeler.
And I'm Dr. Paul Zalza.
And our guest,
Dr. Bev Chan.
Dr. Chan is a vascular surgeon who has graced us with her presence to talk to us about varicose veins.
Veins. We talked about arteries before,
Yep.
or if we release this video first, we're talking about arteries after. Arteries carry the blood away from your heart. That's the oxygenated blood. Veins bring the blood back to your heart. That's the deoxygenated blood. Arteries have like a thick, strong wall. Veins are a little more loosey-goosey.
Right.
Just to put it in perspective. Dr. Chan, thank you so much for joining us.
Thanks for having me.
Okay, so what is a varicose vein?
So a varicose vein is when the valves inside the veins are not closing properly. So inside veins there are these one-way valves to prevent the blood from pooling downwards. So if the valves aren't closing 100% together, with gravity we'll start to see some of that dilatation of the vein. And then they start popping out and becoming like ropey snakes on the legs.
That's the varicose.
Yeah, that's the varicose vein.
Got it.
All right, so there it is. Veins trying to get the blood back to your heart, have little valves in them to let the blood go one way and not back the other way, because as you compress your muscles and walk, you push the blood and hopefully you keep pushing it back to the heart. If those veins are incompetent, the mechanism won't work and you won't get the blood to go back to the heart as efficiently, and it pools in those veins and dilates them, and then you can actually see them through the skin.
Yeah.
And that's what we call varicose veins. Okay.
Right. And so there are both superficial and deep veins. So usually you do not, so you tell me, so which one's more of a problem? Or both? It's equal.
Both are,
Yeah.
right? So the deep problem is, I'll see that in my patients who've had a previous history of a blood clot.
Okay.
And so the blood clot damaged the deep veins.
Okay.
And that's when they'll come back and they get like swelling in their legs.
Right.
And so you don't like swelling in the legs,
No,
right? Like
no.
that's uncomfortable.
Right. And people don't like how it looks either.
Yeah.
Okay, and then superficially, what kind of problem does the superficial ones cause?
So most of my patients will come to see me for a varicose vein problem because they're actually having pain.
Right.
So they're having heavy, tired legs, they have pain in them. More so that for cosmetic reasons, actually.
Okay.
Yeah.
Oh, okay. So the cosmesis is not as big an issue here in Canada because we're always wearing pants because it's so cold. Maybe in a warmer climate.
And we're less vain.
Yeah. See what I see? Get it?
I feel like that's a Zalzal joke. I stole that. That's like low-hanging fruit.
It was fairly superficial, though.
Right. So more importantly, so why does it happen? Like, why do our veins fail?
So inflammation of the veins.
Okay.
So a lot of it's family history, occupation.
So prolonged standing.
Gender. So we'll see it more in females.
Okay.
So hormones play a factor in veins as well. So
You
with
see it more in pregnancy and postmenopausal, or not necessarily?
Yeah, postmenopausal.
Okay.
Yeah.
I can see pregnancy because of the higher fluid loads and more demand.
That pressure down in the pelvic area, right? Yeah.
Okay, so you made the diagnosis of veins. You might have some pain, you have some swelling. You go to see your doctor, you get referred to a vascular surgeon for treatment. What do you do when you see someone comes in your office and they say, okay, I'm here for varicose veins?
So really trying to delve in why they want to get their varicose veins treated. Is it because they're having symptoms? Is it more of a cosmetic thing for them, as well as taking a good thorough history in terms of family history, if they've had a history of blood clots, bleeding issues. So if some of these veins sometimes will rupture, so they'll come to emerge with like a wrap around their leg to stop their bleeding because they're so bad. If they have like venous ulcers, so a small proportion will get like bad venous ulcers, and you never want your patients to come in with that. You want to prevent that from happening.
Okay, so you've got the spectrum of issues that can happen with this. One from some unsightly, you don't like the way they look, to pain, swelling, heavy legs, to really we're having a problem with the tissues. The tissues are breaking down because the venous insufficiency is so severe. So like a lot of things, there's a spectrum of problems that can happen with this condition. So how do we treat it?
So first off, we have to do an ultrasound to take a look to see which part which veins are broken, because that makes a huge difference in terms of what kind of treatments we can offer for our patients.
Okay.
If the deep system is broken, a lot of times it is going to be compression stockings, it's going to be more healthy lifestyle things like aerobic activity for their legs, elevating their legs. I'll have some like weight lifters, they'll ask them to actually do less weights actually.
Okay, I should pay attention to that
Do you do a lot of deadlifts?
on a regular basis.
And then that's just because during that activity, the amount of pressure increases.
They're just
It's
like
all about pressure.
forcing all that pressure
Sure,
down
the
their legs.
Valsalvas.
Yeah,
Okay, got
exactly.
it.
They're stressing their veins out.
What about diet? Is there anything that we can take that's going to, first let's start with reversing. So is there anything that we take that's going to make our varicose veins go away?
No.
No, so
Nothing.
there's a lot of YouTubers that say, do this, this is going to make your veins go away naturally. So we hope that what they mean is that this might improve some of your symptoms. It's definitely not going to cure your valve problem. There's nothing that can do that.
Never listen to YouTubers. Okay, so you can't reverse it, but can you prevent it?
Okay, what kind of foods are we talking about, Bev?
So anything's with flavonoids.
Right.
Yeah.
So what has flavonoids?
So citrus fruit.
Citrus fruit.
You can get it in like grapeseed.
Yeah. I believe blueberries, bilberry, and horse chestnut.
Yeah.
Yeah.
The horse chestnut.
Yes.
One of my favorites.
Right, so mostly plants.
Yeah.
Right? This is not, so we're keto and carnivore people, this is not, your diet's not going to help your varicose veins.
But I find that even for a diet, because you'd have to eat like 500 oranges or something a day. So you can get supplements.
Okay,
There's
so,
vein supplements out on the market.
Yeah, a bunch of vascular foods have
Yeah.
made like proprietary blends of
Vein
different
supplements.
things.
Yeah,
Got
there's
it.
vein supplements.
Do you have one that you would normally recommend or not
The
necessarily?
one in Canada I recommend is called Venexa.
Okay.
Overseas it's called Daflon. That's the one that has good evidence, like randomized control trials to actually show that they do help reduce symptoms as well as will make venous ulcers shrink.
Which is the real worrisome one,
Yeah.
right? Is the venous ulcers can really go sideways.
Yeah.
Okay.
Okay.
So supplements.
So that and that broad term we use is venous insufficiency. Is that correct?
Yeah.
You have venous insufficiency in your leg because your veins are working insufficiently.
yeah.
All right. So we've got some prevention and some sort of naturopathic treatments with supplements. Okay. So you're at the point now where either it's hurting too much, or you really can't stand the way it looks, or you're running into trouble with insufficiency, and we need some kind of intervention.
So if there's problems with the superficial veins, on their ultrasound, there are treatment options, okay? Typically there is surgery, okay? So that's literally taking out the broken veins, right? So ligation and stripping, it's been around for like at least 50 years. There are more minimally invasive options. So there's the endovenous laser ablation or thermal ablation. So there's radio frequency ablation as well.
So you're going inside of the vein, doing something to it so that the walls stick together, and then because all your venous systems are connected, it just moves the blood to other places, right? Okay.
Yeah. So there's that. There's venous seals, so that's a medical grade crazy glue to glue the vein shut. And if there's only like branch varicosities and it's not the main system that's broken, there's sclerotherapy.
Okay. So when you say that, you mean injecting superficially or deep into the vein itself, again, to collapse it.
Yeah.
Okay.
Okay, so if you're going to think about it for the veins and you need an intervention, the options, like there's some kind of surgical intervention, the non-surgical stuff has it where you can use a laser to burn the walls sort of and collapse the vein, or radio frequencies, high frequency radio waves to burn, collapse. You can use a sclerosing agent, inject the vein, and that'll make it collapse and stick down. There's some glues, for lack of a better term, that you can inject and squish that vein down, stick it down, or just take the vein out altogether. That's basically...
So lots of different options. And it really is depending on their anatomy, what their vein size is like.
Intuitively, as I hear this, though, you're going to deal with the veins that are broken.
Yeah.
You have other veins that have the same kind of genetic makeup. Is this not something that has potential to come back?
Oh, for sure.
In the other veins, not necessarily the one that you've collapsed. That one's good.
Yeah, it's a lifelong condition.
And how long would the average person get success? Like if you, obviously it's hard to say because every patient's a little bit different, but say at 5 years, how many of your patients that have some type of definitive treatment would be back saying, hey, my veins are bugging me again?
So If they have laser or glue, success rate's about 98%.
Oh,
so a 2% recurrence rate. For surgery, it's about 10 to 15%.
Okay.
So just the trauma from surgery, some people like to grow new veins, so the neovascularization afterwards.
Okay.
And when the veins grow back, they don't come back with valves. So on ultrasound, you'll see like, instead of like one big vein, you see like all these little new growths
They're just straight
everywhere.
tubed, no valves.
And then they're like all like gnarly, like snaky.
Okay.
So that's why you're like, yeah, my grandma had vein stripping, but like they're all back again. And like, yeah, they kind of grew all these new veins.
And depending the country that you
Yeah.
live in, what's covered by your governmental health
Yeah,
plan,
it's-
your insurance,
yeah.
some of it might be out of pocket, so obviously have a discussion with your local healthcare provider.
Yeah, and definitely it's going to vary from one region
Yeah.
to another how you get your veins treated and how much it's going to cost you, if anything. But the good news is if you have this condition, there are some very effective treatments and a lot of different treatment options available to you. So it's a kind of good news thing.
Yeah.
Right? I've enjoyed speaking with two carpenters and a plumber.
There you go.
If you think about it.
There you go. And if you like this video,
Yeah.
please like it, subscribe to our channel.
Dr. Chan, thank you so much for sharing your expertise and your experience with us and our viewers. And remember, you are in charge of your own health.
We'll see you next time.